Welcome you all for the GCSMR free monthly webinar. As you all know, GCSMR stands for Global Center for Siddha Medicine and Research. Our main aim is to promote an integrative approach in health. And we are doing this webinar, free webinar for everyone. We used to do it monthly, but now it's a long gap that we are coming back for this. So we have wonderful speakers, Dr. Anand Chockalingam and Dr. Selva Shunmugam, going to do this webinar. I would like to request Thiru Sivasailam to just introduce and tell about our activity, what we are doing in GCSMR. And like some of you may be very new to this organization and maybe the first time you're coming for this meeting. So Thiru Sivasailam will explain the projects and we are doing our activity in GCSMR. And also Dr. Rama Jayabalan will introduce our wonderful speaker. And also, as a secretary of GCSMR, I would like to express my gratitude and thankfulness for coming today and joining today's meeting. We also have a lot of WhatsApp groups and Telegram groups. If you want to join, we will put the WhatsApp group link. You can join anytime. And also, we are having GCSMR website. Please go and visit our website. It is still under construction, but you can still go and visit those website. And also, if you have any question and answer for this speakers, you can put it in the chat or raise your hand. We will address them one by one. Thank you. And now I'm going to ask the Asylum to come and explain our activities in GCSMR. Thank you. Please mute your speakers. Now we will mute.
Rama, நீங்க PowerPoint போட்டுருங்க. Oh, thank you. You can make it bigger too. So, good morning and vanakkam to all. I am Sivasailam and I am the president of Global Center for Siddha Medicine and Research. We have been coming up with ideas what to do, and then we thought what GCSMR stands for is it's basically bridging healthcare and it's an integrative approach with traditional Siddha medicine. Next slide, please. Just to give a quick background, GCSMR is a nonprofit. It's registered as a nonprofit both in the US and in India. And our vision is to facilitate integration of traditional Siddha medicine through evidence-based research. As you can see from our organization's name itself, it's Siddha Medicine and Research. And we are also partnering with a number of other Tamil organizations and institutions. What have we achieved over the last 5 years of our existence? We have done taken Siddha outside Tamil Nadu. Everybody in Tamil Nadu knows about Siddha medicine, but our goal was to spread the knowledge, the traditional Siddha medicine knowledge outside Tamil Nadu. As part of that effort, we have started we signed an MOU with Manipal Academy of Higher Education, MAHE, to start what we call a Siddha chair. And can you make it big? The slideshow is showing up as small. So, thank you. And in the US, we have also done a lot of work with Morehouse School of Medicine in Atlanta, Georgia. And as a result of the work we are doing there, we have introduced Siddha Elective for medical year students, final year MD medical students in their 4th year. And whoever has been taking the Siddha elective course, they spend about a month in India, both in Chennai and Mahe, going through seeing patients. And there's also some cultural introduction of what is India also for these students. And next month in September, 4 students and the faculty, 2 faculty are going to India. And then in Tamil Nadu also, we don't want to neglect Tamil Nadu, where Siddha is very prevalent. And we have been trying to do some research as well as publish some books. Next slide, please. I'll talk a little bit more about in detail about what's going on with MAHE. And as I mentioned, the first step we did was once we signed the MOU, we have started a Siddha outpatient department under Ayush umbrella at MAHE. And we are also, number of PhD students have enrolled, and they are all doing research using Siddha medicines as and their effectiveness. And actually, I believe currently 3+ students are doing that. And then thanks to the generosity of Malika Janagram and Mrs. Malika Janagram, we started a postgraduate Burma therapy course at MAHE. It's open to anybody who's in the health-related field. The first cohort was about 6 students, and then the second 6-month course, we have 10+ students. And other things that are under consideration at Manipal, we are in consultation with the Vice Chancellor, Pro-Vice Chancellor, and all that. We wanted to start a postgraduate MD program in Siddha medicine, not a BSMS. The undergraduate, it's already there in Tamil Nadu, Kerala. But we wanted to start a postgraduate medical education program, MD program. And to get accreditation, we need to have a 50-bed hospital, inpatient hospital. So as part of that, we are trying to raise funds. The total cost of all the projects at Manipal would come to about 2.5 crores. Through the generosity of number of donors, we have collected close to 50 lakhs. So we would still need about 2 crores for that to do this, as well as other. We have the MOU. We have a number of other activities that we wanted to start at Manipal. Next slide, please.
நான் நீங்க உங்கள்கிட்ட பேசணும்னு அவர் கூப்பிட்டேன். அதான் சொன்னார் 6க்கு வந்துட்டு 8 போகிற மாதிரி வச்சுங்கன்னு. சரி, நான் உங்களோட கோஆர்டினேட் பண்ணிக்கிறேன்னு தான் சொல்லியிருந்தேன்.
வணக்கம்
முடிச்சுட்டு அந்த சைட்டை பார்த்து நான் புக் பண்ணிடுறேன். அப்புறம்
Dr. Janagiraman, can you mute your phone, please?
Okay. Worldwide, we are doing 30 webinars, 30+ webinars from the time of COVID. We've been doing monthly webinars on bridging healthcare using integrative approach. So most of the webinars, we have a modern medicine doctor and a Siddha doctor, and then both explain what they do towards achieving the healthcare that we are trying to achieve. We also do online Siddha consultation. And in the US, as I mentioned, Morehouse School of Medicine, we are doing a number of activities there. We have introduced elective Siddha course for final year MD students. And this year, this semester, 4 students. And we also ended up appointing, our Morehouse has appointed 3 adjunct Siddha faculty, Dr. Selva Shunmugam, Dr. Arul Amadan, and Dr. Uma Sandil Kumar. And we are also there. There are some of the MD students, one MD PhD students is interested in creating a herbal garden. And we are investigating the possibility of creating a herbal garden. And most of these herbs are what is used in Siddha formulations. And also in the works is creating a wellness workshops, again, under the auspices of Morehouse School of Medicine. Next slide, please. Publications, we have brought out 2 publications, one in Tamil and one in Kannada. And then, again, mentioned randomized controlled trial. It's ongoing currently in Tamil Nadu, in the outskirts of Chennai at a primary health center. randomized control trial of Ventamare Churanam in treating hypertension, and the cost for that is 10 lakhs. Next slide, please. And at this time, I mean, even though GCSMR, most of us are non-physicians, all we have achieved, I want to recognize three people. One is Dr. Rajagopala Sridharan at Morehouse School of Medicine, Dr. Arulamadan at Mahe, and Dr. Selva Shunmugam with Health India Foundation. Due to their hard work and dedication, we have been able to most of these results. So I really want to thank them. I also want to congratulate recently, or within a week ago, Dr. Selva Shunmugam has been appointed in the advisory committee under Ministry of Ayush, Delhi, as advisor for streamlining and enhancing the BSMS medical education for Siddha students. Next slide, Rama. Okay, thank you. Yeah, the next slide is, I just want, I mean, all this would not be possible without the generous donation of a number of our folks. We still need to raise more than 2 crores. So I would request everybody to contribute whatever you can, even if it's small. You can contribute either in the US or in India. And all contributions are, if it's in the US, you will get 501(c)(3). We are a 501(c)(3) corporation. So you'll get your donations are tax deductible. And India, if you donate to Mahe directly, then you'll get tax deduction. But the Indian arm of GCSMR hasn't yet obtained our ATG. We are working on that. Once we do that, then that's also tax deductible for India. With that, I'll stop here and ask if there are any questions. We'll try to answer that. Tamara, do you want to leave the questions till the end?
Yeah, you can leave the questions in the end. Thank you, Tirusivasailamanna. Thanks for that. There's a lot of projects, and you can see all these projects and its development in our website. We have put a lot of information in our website too. You can refer that. And thanks to all donors and sponsors who have make these projects up to this level. But still, we have a lot of distance to go. We want everyone to contribute and help us in whatever way you can. And also